Good afternoon. This is Amy Wheeler, and I am so happy to have Steven Inghram with us today. And he'll have to correct me if I said his name incorrectly. We'll get to that in a minute. But first, a few announcements. First of all, just so much gratitude to Give Back Yoga for helping us to co-produce and market this podcast, and would love to invite any of you to join us every single week for this podcast live. You can come in as an attendee and ask questions, and you get all 4 podcasts each month, plus 2 other courses for $19 a month. So I just would love to encourage people to Give Back Yoga in gratitude for all that they're doing in the world, all the good that they're doing in the world. And then a second announcement is that Optimal State Yoga Therapy School is our sponsor for this week. And every September, we have a 9-day module where we go through all the major parts of the body: your neck, your low back, your mid back, your knees, your hips, your ankles, your elbows, your wrists, hands and feet. And we teach you how to assess from a yoga therapy perspective, and also how to build therapeutic treatment plans to help people feel better in their body and experience less pain. So if you're interested in that, come to www.amywheeler.com and we can tell you more about it. I'm so thankful to have you here today, Steven. How do you say your last name?
You said it correctly, Steven Inghram.
Perfect. I'm really glad, because I usually mess up names. So Steven, I have been an admirer of yours. You know how you just scroll through Instagram and mindlessly, and then maybe a couple months ago, 2 or 3 months ago, I ran across your show on Instagram called Queer Story Time. And it's actually, your handle is Future NMD Yogi, which we'll find out what all those letters mean in a minute, but that's where Queer Story Time takes place. And by now you've had 41 episodes of 1 hour each, where you are interviewing people from the LGBTQIA community about life, how they experience life. So why don't you tell us a little bit more about Queer Story Time? Because I think as yoga therapists, all of us should go and watch these episodes. They are so packed full of the human experience to help us become better yoga therapists, I think.
Yes. Yeah, so I started Queer Storytime on a whim, having no idea what I was doing at first. I just had this, from doing the work that I do as a yoga therapist and hearing stories kind of privately, in the therapeutic environment, I just began to recognize over the years that there's real power in people vocalizing and sharing their stories, not only for our own self-healing, but for our community to become educated about our experience, and to empower others by listening to our stories. So I just one day said to a good friend of mine who's a trans woman, hey, I want to do this. And she's really good at graphic design and making those little, pictures that we all post on Instagram to advertise events that we're doing. And I said, hey, I'm going to do this. Will you help me out? And she did. And I actually asked her to be my first guest. And it just took off like wildfire ever since. And yesterday, I just finished episode number 43.
You've been going, I can't even keep up. I've probably listened to 15 of them. My husband and I have dinner and listen. And sometimes in the middle of the day, I'll lift weights and listen. And I just am so touched by every single story I've listened to, the amount of human suffering, but also, as I've told you privately, the ability of your guests to be so authentic. And most of them are actually very joyful and so honest about who they are. To me, that is what we're doing in yoga and yoga therapy. That Yoga Sutra 1.3 that talks about getting in touch with your deepest inner self
Mhm.
and being who you really were meant to be in this life. And I feel like every single person you have interviewed has found that for themselves. And I bet most of them have never done yoga. How do you
Yeah,
explain that?
well, I through my own life experiences and, being a yoga therapist and now doing these episodes of Queer Storytime, um, I just keep coming back to this phrase in my mind that is, with great suffering comes great wisdom. And
Mm.
that's what it comes down to. The LGBT community, and we will talk about that acronym and variations of it in this episode, but this community, the queer community, has experienced deep trauma and suffering from the ways in which our society expects people to be, and it has caused a lot of harm. But out of transforming that harm within ourselves as queer people, comes great wisdom and awakening, and that is so well displayed on Queer Storytime.
I feel so alive and energized and joyful after every single episode because just in hearing you and your guest talk, it's almost like a contact high
Hmm.
to be like, oh yeah, I want to be real. I want to be authentic. I want to let my true light shine and not have to hide who I am in any way.
Yes.
So can we start with your story? And we're
Hmm.
both PKs. You're a Methodist pastor's kid, and I'm a Lutheran minister's daughter. And I just want to hear your personal story before we get into all the different ways that yoga therapists can be informed and become better yoga therapists as a result of listening to this episode. But how about you? Tell us about you and how you came to know yourself.
Yeah. I so I will give the maybe not edited version, but the shorter version, just in the essence of, all of the conversation that we're about to have. I'll give the abridged version, shall we say.
But they can hear a longer version on episode 41.
Correct. You can hear,
Okay.
I would say, the majority of my life story on episode 41 of Queer Storytime. I actually, the primary focus of that was around sexuality. I didn't get to talk a lot about gender in that episode,
Mm.
only because I try to keep them to like 60 or 90 minutes. And then people were just asking a bunch of fun questions. So I just kind of went with it. So people can listen to that. But yes, I grew up the son of a United Methodist minister. I don't know if anybody knows what is happening right now in the UMC, United Methodist Church. The church is soon going to be fracturing over homosexuality and gender identity, and just LGBT issues in general. So there is a very conservative traditional group called the Wesleyan Covenant Association, which has traditional views of marriage and of being human in general. Um, and then there's a very progressive, open, accepting side of the United Methodist Church. And these two groups just cannot be reconciled. It's to that point. So I haven't received any updates from my father about what is happening in that regard. So I don't know when that is officially happening, but it has been in the works for decades, really. So yeah, I grew up in the UMC, um, as a pastor's kid, and I will say, because I think, sometimes there's perspective that, um, gender and sexuality are only adult conversations. And that's not true. Um, I knew that I was different, so to speak, um, at the age of 5, 6, 8, maybe.
Mm.
And so many of the people that I've interviewed on Queer Storytime, specifically in regards to gender, have spoken, that they knew they were different at 3, 4, 5 years old. We just may not necessarily have the language to articulate it at that young of an age. Although I do think kids nowadays do, which is amazing. Um, and so yeah, that's important to point out, that I did recognize that something was maybe different than my friends that were boys, those counterparts in my life.
Can you give us a tiny example of, I mean, when you look at a 3, 4, 5, 8-year-old child, in my mind, I think, well, what did you look around and see and think, that's interesting? Do you remember anything
Yeah, I
specifically?
mean, you know, there's definitely, and I think this was, maybe not at 4 or 5 years old. I'm trying to kind of reflect on my nephew. My nephew's around that age,
Mm,
um, where these kind of where these gender expressions begin to manifest. And my nephew is very much a boy and has exclaimed that he is a boy, and he's about 5 years old. So and then around that age, when you're in kind of preschool, kindergarten, you get to have crushes on girls or boys, and yeah, I always remember that I had crushes on boys.
mm,
and and my friends that were boys had crushes on girls. And so at the time, I didn't see it as wrong or anything. I just was like, this is how I don't think I analyzed it that much as a 5-year-old.
right.
um, because it just felt like a natural expression of who I was at that age. Um, and then it wasn't really until my family, so my dad was a Methodist minister in the Western Conference of Pennsylvania, the Pittsburgh area. And then it was fairly kind of untraditional for ministers to be moved from one big conference to another. But my dad was one of the ministers that got moved to the Eastern Conference, the Philadelphia area of Pennsylvania. Um, and it was when I was in middle school, which was actually north of Philadelphia in the Eastern Conference in the Poconos, um, where I started to become bullied for, being perceived as gay. Well, I didn't even know what that word really at that time meant,
Mm,
um, until, you know, people began to explain it to me. And then I began to make associations. Oh, this is, yes, I do have attractions to men. So then, you kind of just understand, okay, well, I'm gay. Um, and
and how old were you kind of when you had that realization and had a word to articulate it with?
yeah, um, well, middle school is is what age? Like
Probably 12, 13.
12, 13, exactly. Yeah. So I would say it was around that age. And I was telling the story on Queer Story Time the other day that one of my biggest bullies in middle school, I ended up becoming friends with in high
Mm,
school because she was a lesbian woman. Um, and so it was middle school is a hard time for everybody.
yeah.
And high school can be too, depending on where you live in the country. And yeah, so I kind of went about my life identifying as a gay male for the longest time. But and the other thing that I expressed in the episode of Queer Storytime is, and I think this is where the trauma piece comes in, is I was experiencing bullying in middle school. Um, and then I was experiencing bullying in church as well. Hearing messages, and actually not from my father, um, just to make that clear.
Mm,
Messages from people in the church, in Sunday school, and just other environments where you hear, that love the sinner, hate the sin, that whole thing. Or you just hear that being homosexual is not accepted by God. And so I struggled for a long time hearing those messages, just those hateful, harmful messages. And so I was angry for a very long time. And part of the amazing thing about queer story time is it's kind of it's kind of it kind of shows how much personal progress I have made for me to be out there and advocating and as vocal as I am, because being this, I don't know if you ever felt this way, as a pastor's daughter, um, being a pastor's kid for me, and my dad being in the position that he was in the community, my family was always very well known. And
Absolutely. Yeah, we always say bad news is going to beat us home. Like we couldn't get across town before somebody had told somebody what was going on with the Wheeler kids.
yes, yes. So because my family was always kind of in this public spotlight, I always felt like I had to silence these parts of myself. And so that was so difficult. So I think the reason that I am so vocal now is because I spent years suppressing this truth.
And may I ask, and we don't have to go into this, but were you ever able to reconcile with the church? Or do you kind of feel like, yeah, that's just not going to work for me?
You know what? As of the last couple of years, I have been able to reconcile. I wouldn't necessarily call myself a Christian, so to speak. In college, I did a lot of, in college is where I began studying Eastern philosophy, Buddhism, and yoga. One of the first books that I read was Thich Nhat Hanh's book, Living Buddha, Living Christ. And so it kind of really bridged Buddhism and Christianity, because I just was, I've always been intuitive, and I had this thing inside of me saying, you need to explore Eastern philosophy. And so I did. And so I found that book, and it was like such a phenomenal bridge between this like inner knowing inside of me that said, hey, study Buddhism, go check that out, and my Christian upbringing. So after I read that book, I was like, oh my God, I need to study more Buddhism. And then that got me curious about yoga, which I started really kind of practicing yoga. I would say my sophomore or junior year of college, which, because of all of these experiences and this repression of my inner truth and these repetitive traumas, this repetitive bullying that I experienced growing up, I started having panic attacks in college.
I can
And
imagine.
I remember calling my mother one day and explaining to her how I was feeling. And at the time, I had no idea what a panic attack was. And yeah, so anybody that's experienced a panic attack knows how utterly debilitating they can be. You almost feel like you're dying. You end up thinking, oh my God, is this it? What's going on with me? So my mother, said, you're having a panic attack. This is what's happening. My mom's a social worker. And so it really was from that point on, knowing and understanding in that moment and experiencing how debilitating a panic attack can be, and experiencing that multiple times.
Yeah.
I knew that I had to do something different. And that
And
was
this is,
yoga.
I was going to say, this is so beautiful because, as we know, and you can give us some statistics, people, LGBTQIA plus people, their incidence of mental health
Mm.
problems is so much higher, all the way to, you told me the other day that um, Black trans men have a life expectancy of 35 years.
Black trans women.
Women, I'm sorry, yes.
Yep. Black trans women have a life. Yeah, I just would like everybody to sit with that. Black trans women have a life expectancy of 35 years. That is unacceptable. And one of the other statistics that's, I mean, pretty well known in the LGBT community, but maybe not so much outside, is that we can reduce the rate of suicide among LGBT individuals by 40% with in the case that that individual has one accepting human being in their life.
Wow.
So think about if they have 2, 3, 4, 5, 6 accepting human beings, a whole family of acceptance, the rate of suicide dramatically drops. And so that's the importance of being educated on this topic.
And we as yoga therapists could be that one person.
Yes.
So is this why you went to MUIH to get your master's degree in yoga therapy, for your own health as well as wanting to help other LGBT people?
Yeah, I have to give a shout out to my initial yoga teacher, Colleen DeVirgili's Siva
Mm.
Power Yoga in Westchester, Pennsylvania. She doesn't have the studio anymore, but um, she, she's amazing because I really feel that she taught yoga. And, there's a lot of conversation right now on decolonizing yoga and getting yoga back to the roots of Indian, its traditional Indian roots. And she was very steeped in that. This was back in 2010, 2012 when I did my initial yoga teacher training. And so I'm so grateful for that. I had one of the ways in which I had coped with all of this in college was I was a huge runner.
Mm.
And so that just, I was kind of running away from my problems. I can see that now. I wasn't really addressing the root cause. I was just kind of running away and kind of remaining in that stress response, that fight or flight response by running all the time. And so once I started my initial yoga teacher training, I went to power yoga because I was athletic. I was like, I didn't know that yoga was anything otherwise at that point in time. I just wanted an active, athletic asana practice. And through this training and through my relationship with Colleen, I recognized the profound power of yoga. And so I had taught yoga for about 5 years as a 200-hour teacher. And then about 2014, 2015, I mean, I know a lot of this scientific research had been going on for decades, but it seemed like 2014, 2015, there was just a plethora of scientific research coming out in support and validating this ancient practice. So that got my curiosities piqued. And I had always been interested in science growing up, but I didn't in college. I was a music major. I didn't do pre-medicine or anything. And because the music community had always provided me that place of acceptance. And then I kind of found that in the yoga community as well. And so I was teaching for about 5 years, noticed that all this research about yoga was coming out and kind of just figuring out what I wanted to do with my life. I had graduated college with a degree in music and was debating whether I wanted to continue on in the music world. And I had this huge draw towards healing, just in my body. All of me was saying, you need to look into these healing practices more. And so that's when I was looking into, do I want to become a psychologist or, go into psychotherapy? And just because of all of the experiences that I had in yoga, that drew me towards yoga therapy. So I did the 2-year master's degree at Maryland University of Integrative Health. And it was then where I got more of the science and more of the understanding of the human body, that I was like, oh my God, this is powerful. Going into the program, I had no idea what yoga therapy was, but I think we see a common theme here with me is I just jump all the way in and find out what happens.
Well, and you said earlier that you're very intuitive, and I
Mhm.
think in the yogic text that listening to your deeper knowing or your deeper wisdom and going for it is the highest form of intelligence, even if we don't
Yeah,
have a logical, rational, you know, list or reason why. There's a knowing. And
yeah,
what I've heard you and your guests on Queer Storytime talk about is you're willing to listen to that inner knowing and follow through, which most of us are not, because we're scared to death to listen to it. And hell no, I can't follow through with that.
yes.
Right. So
And
I
we
think you
will,
land where you need to be.
yeah, and there's certainly a place for that conversation to come back in the midst of
Okay. We'll come back to that.
what we're about to talk about. Um, so yeah, I started doing yoga therapy, and I wasn't, when I graduated, actually the one of the most profound things for me in that program was, yes, learning all of this amazing knowledge and how to help people heal, from a yoga therapy perspective. But I didn't even accept, that I had trauma or had experienced trauma in my own life until we had real conversations about
Mhm.
trauma in the yoga therapy training program at MUIH. So I very clearly remember sitting there in class and having that oh my God moment just where you almost go flush and you're like, oh my God, this is me.
Yep. We
Um,
we have that happen in our program. In fact, we have a 9-day mental health module in July. And every time we're in that module, people sit there looking stunned, and you can just see it flooding in
mhm.
that here I am trying to learn about this, but oh my God, this is me.
Yeah, yeah. So after I finished the yoga therapy program, I never even had the intention of maybe necessarily working with the LGBT community. But the more that I have done my own work, and the more I notice the inadequacies in the world around training, offering training, to people, even within the community and outside of the community that are healthcare professionals or in integrative medicine, there is a real major lack of
even
training.
even in your medical doctor training that you're now in at the Southwest College of Naturopathic Medicine in Tempe, Arizona, you were telling me that even medical doctors are not being taught anything about LGBTQ, and especially not the trans community, which is so desperately in need of medical care.
Yes, things are slowly changing. Um, but and this is kind of a segue where we can kind of segue from um, talking about me. Although I do want to, before we move in that direction, I do want, this is important to note, because we're in this podcast specifically, we're talking about trans health. And I do have to say that I huge shout out to all the trans women and trans men in my life. Um, because I have, over the years, I identified as a gay male, and that identity in me is becoming less and less. There was that intuition that I've always had since I was a young kid, knew that label, even though many of us, of course, I had to work through internalized homophobia. All of us do, as queer people. Um, I through my relationships with the transgender community and the gender expansive community, gender diverse community, I've recognized that all of us, regardless of whether you identify as LGBT or not, there is a great need for all of us to do that inward work that yoga allows us to do, to begin questioning our own gender and sexual orientation. And so I had done a lot of the work around accepting my attraction to men. People, I should say, people assigned male at birth, is the language that we're using, and I can talk more about that. But I, yeah, so my relationship with them got me acknowledging that, hey, there's something inside of me that, calling myself a gay male just doesn't fully sit right. And so right now I'm in a place where I use the word queer, because queer is this kind of open, expansive, inclusive term for both sexuality and gender. And this is the major message for everybody that's going to listen to this, is that both gender and sexuality are fluid. Can be fluid, and that's one of the Buddhist teachings, and one of the yogic teachings as well, is that life is change, and it's when we resist that change that we cause more suffering. So I think people are, as you said, people are super nervous to go within and really take a hard look in regards to their gender and sexual orientation. But that is part of the work of being human. Doing that work is inclusive of all of the human experience, not just compartmentalizing the human experience and saying, "Ooh, I'm not going to look at that."
And I loved what, you and I talked for a few minutes yesterday, and you were saying even people who are cisgendered or consider themselves heterosexual, we also need to do this work around gender identity and sexuality and the fluidness of
Yes.
both. That this is not only for LGBT people, this is for all of us as part of being human.
Yeah, gender and sexuality is a human experience. It is not just an LGBT experience.
Can I bring up the gingerbread just to talk about the different aspects? This is a very simplified infographic, but we decided to keep it simple because I think for a lot of us who are just really learning about the language that we should learn how to use, as well as
Mhm.
the different possibilities out there, can you just take us through briefly the gingerbread person 2.0?
Yeah. Um, so the major thing, and I think I may have stated this already, though in my Vata mind, I'm very Vata, air, airy. Um, I don't remember if I said it, but gender and sexual orientation are two separate things. That is the basic foundational thing that we need to understand working with this community. Um, and so beyond that, what is the major thing occurring with transgender individuals is that um, the sex that they were assigned at birth does not align with what is in their heart and soul and brain. So their brain, heart, and for example, if there's a person assigned male at birth, and we're talking about them being transgender, their heart and soul and inner intuition and mind is telling them that they are female. Um, and so when we look at it from this perspective, what is between somebody's legs, the genitalia between their legs, has nothing to do with the felt experience that is in their heart, mind, and soul. And so I want everybody to keep that in mind, that when we are talking about transgender individuals, it has nothing to do with the genitalia between their legs. that is an anatomical part that serves a particular function, and that is it. And so we really have to get beyond thinking that women have particular genitalia, men have particular genitalia, and it's not at all that black and white. Um, and the word that I love using, just because um, our society wants to box us in, and I think one of the major goals of white supremacy is to keep everything boxed and cohesive and in understandable terms and language. And that's just not the reality of life. There is a lot of nuance in conversations about gender and sexual orientation. So I hope that what I'm articulating is making sense in that way. So the other important piece of this is that, you know, there are people that are, it's becoming more common for people to identify as non-binary. And so the important thing here to note is that our culture has so boxed in people to identify as either male or identify as female. And so it's common for people to think that trans and queer people are somewhere in between. But that's not exactly what we're going for. I heard the term gender expansive recently, which is so on point because it makes space for gender to become more than the space between male and female. And we don't want to box people into finding a space somewhere between male and female and accepting that. If they feel genuinely in their heart, mind, and soul that they are outside that binary and outside the space between the binary, then that's what gender expansive is referring to. So allowing, and we also have to recognize that this is, it's important for us as yoga therapists to recognize that this is, gender and sexuality are very subjective. And by that, I mean, we have all of these terms such as non-binary, gender fluid, agender, gender non-conforming, yes, and intersex, asexual, all of these terms, whereas they do have specific definitions, this is where it behooves us as yoga therapists to ask our clients to explain their identity. Because whereas there are these generalized definitions that you see on the screen right now, LGBTQIA, the LGBTQ plus, we'll just say, whereas there are these generalized definitions for those labels, so to speak, they're so much more expansive. And there is conversation in the community right now to get rid of those letters.
They should. Why do you have to choose a letter? I
Yes.
love gender expansive.
Yes. And so we're trying to, and of course, there's debate in the community about what we're calling ourselves. But some of the common language that's being talked about is GSM, gender and sexual minorities, although some people don't like that in the community. So another one that I've also heard is gender and sexual diverse community. Because of the nuance that I'm talking about here, we're noticing, we as a community have acknowledged that there's a lot of nuance between the letters, so to speak. And that has to do with the fact that there's a lot of complexity, as I've said, when it comes to gender and sexual orientation. So I was explaining earlier for myself that identifying as a gay male, whereas I have used that language in the past, because it, like, people automatically understand what that means. It's an easy way to communicate, but that label does not, it's not expressive of what I am feeling internally.
Which
And
is,
so what I'm feeling internally,
yeah.
um, that I probably am more non-binary. I
Mm,
personally, and I want to be very clear about what I'm going to say here. I personally don't resonate with that label myself. I am not saying that to invalidate other people who do use that label. Um, that label does not sit with me. It doesn't sit well with me personally either. Um, and that's why I've just kind of settled on queer. And I know that term in and of itself was kind of divisive and kind of unacceptable at one point in time. But throughout time, and as people's minds evolve and as consciousness evolves, we're able to kind of reconcile some of these terms that um, previously may have been more of a derogatory term. Like, I had a gay male on Queer Storytime who's 60 plus, and he was telling me that the word queer during his time was not something that you wanted to be called or wanted to use as your identity. So I personally feel that the word queer is such a powerful, because the word queer is a very powerful way of identifying, because um, in identifying that way, you're making a political statement
mm,
about your beliefs. You're making a statement about your gender not conforming to um, the cis, meaning that your biological sex, the sex that you were assigned at birth, is the same as the way that you identify in your heart and mind. So just using you as an example, Amy Wheeler, um, identifying as your biological sex is female and you identify as female. That's what cisgender means. Transgender, as I was explaining earlier, means the opposite.
mm.
Um, so
May I ask a question?
go ahead.
So, as yoga therapists, I was having a conversation with a friend, a mutual friend of yours and mine, a couple of days ago, and you just said we should actually ask what it is that this client or would like to be identified as.
Right.
But I would never do that to my cisgendered people. So it feels a little strange for me then to see someone who maybe is wearing eye makeup, a man who's wearing eye makeup, and start asking about their gender and their sexuality. To me, that seems a little, why would I do that to them? But please help me understand why that's important, to
Yeah,
acknowledge it and to see them how they want to be seen.
right. And this is where I have a couple thoughts here. This is where this is a huge mindset shift for some people. Um, we have to get to a place of um, I am very male presenting right now. I have a beard. I have what in the medical profession we call secondary sex characteristics that make me look male and make you look female. We have to get to a place in our mind, and especially as yoga therapists, because we are doing therapeutic work with people, that regardless of how somebody looks externally, that doesn't necessarily mean that that's how they that's how that aligns with their gender. So we have to get to a place where, you know, I'm using you because we're here on this conversation.
Fine, go for it.
We have to get to a place in our consciousness and where we process this and can come to a place of acceptance of it within ourselves, that when we see another human being out in life, we we don't assume their gender based off of how they look externally.
Beautiful.
Yeah. And I know that's like, oh my God, well, how can you say that? You look very male, Amy looks very female. The way that we look externally does not always coincide with how we feel internally in our heart, soul, and mind. And
And that's where that inner work comes in, because so many people have just accepted the birth gender that they were given and have not even had that conversation or consciousness within themselves to ask,
yes,
do I feel the way that I'm presenting in the world?
yes, exactly. And I think that's where so much of the hate for trans people comes in.
Mm.
Is that people hating against the trans experience haven't even questioned their own gender. So it's yeah, it's almost as if we can't even really have an honest conversation about this unless people have done the work themselves to question their own gender, even if they identify as cis and heterosexual. Like I was telling you yesterday, it behooves all of us to do this inward work and to ask ourselves these questions. Because if we're not doing this work, we are continuing to promote uninformed biases about people. And that's causing such tremendous harm. Um, and as yogis and as yoga therapists, it behooves us to do the work of do no harm. And
Ahimsa.
that's ahimsa. That starts with us doing the work internally ourselves. So I hope
So
that,
Steven, can you role play with me? I'm your client and I'm presenting as female. You're my yoga therapist. You are already in the consciousness that how I'm presenting on the outside may not be how I'm feeling in my mind and my heart. What would you say to me? What language would you use to check in with me and ask how I would like to be addressed or perceived? Like what would that language sound like?
yeah. So the first major thing that you can ask somebody is, what are your pronouns? How do yeah, you can ask, the best question to start out with is, what are your pronouns?
For everybody,
For
every
everybody.
single person.
Every single person that we meet, regardless of whether we perceive them to be cis and heterosexual, we should be asking them what their pronouns are. That should be, and yeah, and not just for the LGBT community, every human being on planet Earth, we should be asking them what their pronouns are.
And can I just say, this was the first semester at the university that I teach at, that every student came on the roll sheet and their pronouns showed up for the very first time in 25 years.
Wow.
And we just we're talking about Zamaya, this program that helps yoga therapists document and track. At your suggestion, Jenny Williams from Zamaya went ahead and put in many, many different categories for pronouns and gender identity.
Yeah, so then when you ask a client what their pronouns are, then you can ask the follow-up question, how do you identify? Because then it leaves, one of the big things about yoga therapy is asking open-ended questions. It's not pigeonholing anybody into identifying a particular way. And you and I were having this conversation too. It's almost best on an intake form to leave a space for pronouns and ask very specifically, how do you identify, in terms of gender and also sexual orientation, and just leave it blank, because the caution here is that if we have just a tiny little list of,
Mhm.
label, so to speak, that if somebody doesn't fit any of those labels, well, then that's kind of then we're doing harm by not acknowledging that there are other expressions of the human experience than what we have on than the little, 5 little labels that we have on our intake form. So it's almost better to leave a space for pronouns, ask them to physically write their pronouns in, leave a space for gender identity, allow them to write that in, and also I would leave a fairly like open space to allow people the opportunity to feel like they have the space to express that, not just some tiny little um, space on an
A
intake.
couple of lines. And I
Yeah,
can imagine for a queer person, this would be like, oh my God, the angels are singing. But I can also imagine for a cis person that doesn't even understand the trauma and what queer people have gone through would feel almost offended at you're asking me my sexual orientation on your intake. That's none of your business. What do you say to that?
yeah. I That's a great question. I would say that first of all, it's, for us as holistic practitioners, if a client said, well, why are you asking me my sexual orientation? I would say that for us as holistic practitioners, it is super important for us to understand all of the little details about their human experience. And that includes things that they may be uncomfortable with, their gender identity, their sexual orientation, how many bowel movements they have a day, like these,
The poop questions.
the poop question, the things that are kind of seen as taboo.
Yeah.
Um, that it gives us a whole picture of who they are. We can't help them heal if we do not have an authentic whole person view of the client that's sitting in front of us. So that's what I would tell them.
And I would also say that, our work as yoga therapist is confidential, and we may be a safe place for them to express that for the very first time
Right, right.
with a compassionate, kind human being that they can trust it won't get back to their network until they're ready to come out.
Yeah, absolutely. Yeah, and just yeah, setting up that therapeutic space and making it known. And I think this is where in some of the language and on your website, or um, when you send the intake form, or you might send a little brochure along with your intake form, giving the person a felt sense that this is a safe environment, even before you actually get together with them physically, or online nowadays.
So, I mean, what I hear you saying is that we need to be proactive on our websites, on our Facebook Lives, on our Instagram posts, that we are LGBTQIA plus friendly, we are safe, we're here to support you, we love you, that it's not enough to just kind of stay silent in the background and not make negative comments, but that we actually have to go out in front with the flag
Yeah.
and let people know we are here for you. It is safe with us. What do you think about that?
Yes, I can. We had this conversation yesterday, but I can tell you as an LGBT person, knowing the trauma that I experienced, knowing the trauma that I hear about every time I do a queer story time, us in the queer community do not feel safe um, going to a therapist, a physician, whomever it may be, healthcare professional, unless we know that they are affirming, 100% affirming. And I can tell you very personally, I personally experienced medical discrimination for the first time in my life, back in October of last year. Um, because I was, and I honestly don't mind talking about this, but because it just paints the picture that this is very real, and this happens on the daily. And so it's just pointing to the fact of what I'm saying is super important for you to actively identify that you are a safe space for LGBT people on your website, on your marketing materials, brochures, any documents that you send. Make it well known that you are supportive and affirming of this community. Because I went to a physician who, I had just moved to Arizona for medical school and was getting myself set up with a primary care physician. And I was taking something called PrEP, which is pre-exposure prophylaxis. It's a preventative for HIV.
Mm,
And thank God we have those medicines nowadays. Because at the time I was sexually active and I was, taking that medicine to protect myself and others.
mm,
And the physician that my insurance company had assigned me um, was did not know or understand this medication. I saw this physician walk in. He was about 75 plus years old. And I'm thinking, oh, Lord, here we go. I knew immediately that that he was not going to be my physician, but I was there. I needed some medication. So I just, sat through it. Well, the more that I explained what this medication was, the more visibly uncomfortable he became. And he became so uncomfortable with asking me questions in relation to sexual orientation and if I was sexually active. And once I told him what the medication was for, he ended up saying, "I can't treat you," and walked out of the room. So
mm.
that's medical discrimination. And I would not have known that had I, not been in the place that I am as a medical student. So long story short, I submitted a complaint to the Arizona Board of Osteopathic Physicians, and they got back to me and said they were pursuing it, but it technically is illegal under the licensure for osteopathic physicians to discriminate based on sexual orientation and gender identity.
And
Even if
oh, go ahead.
no, even if the state of Arizona itself does not have anti-discrimination laws set in place, the it is one of the one of the code of ethics
Right.
to obtain licensure for osteopathic physicians here in the state of Arizona and probably I'm sure all across the US, that physicians don't discriminate based off of sexual orientation and gender identity. And yet, I still have not heard anything back from the Arizona Board of Osteopathic Physicians. So this is
And
so
I want to add that, I was president at IYT and a big part of creating their code of ethics. And we have the same code of ethics that we cannot discriminate as yoga therapists based on gender or sexual identity.
yeah, and
We're in
it
the same boat.
absolutely, and it honestly behooves IAYT as a governing body to stand firm in that code of ethics, that if there is a yoga therapist that has discriminated and said that they can't, treat a particular patient because of that, that person lose their certification. Because I don't think this physician has lost his license, and it continues to perpetuate harm to our community when that happens. And just allows it to continue to happen. And that's not a place that we want to be in as a profession.
Just like any other breach of the code of ethics, sleeping with your students or, being unethical with money. I mean, it matters. One case matters.
Absolutely. Yeah. Yeah.
So we are getting close to the end of our time, but there's something really, really important that I hope we can talk about if you have a few more minutes. And
Sure.
that is, especially for trans people, this dysphoria and disconnection from their body,
Mm,
and how it's a little bit different than the disembodiment that someone might have, maybe if they had sexual trauma as a child. That there's something very unique for trans people about the dysphoria that yoga therapists need to know and understand.
yes. So let me make two things clear first. Um, Trans people, first of all, there is the belief that in order to be trans, you have to undergo medical transition. That is not true. You
Mm.
can identify as trans, and actually, trans is a huge umbrella term, of which non-binary fits under. So many non-binary folks identify as trans. Um, so that's the first important thing. And then secondarily is the I just lost my train of thought. Went out with the wind.
Well, we were talking about how the dysphoria and
Yeah,
disconnection from your body is different when you're trans
yes.
than
So
maybe other types of trauma that we may have experienced.
right. So the second thing that I wanted to point out is trans people actually do not have to experience dysphoria, is the second part of what I wanted to say, to be trans either. One of my dear friends, who I was talking about earlier, is a trans woman, and has not has been put on hormones. And this is a very, I don't think she minds me talking about this publicly, because she is very open about this. She has been put on female hormones, so she has partly medically transitioned. Transgender folks that do decide to medically transition um, can undergo top surgery to remove breast tissue, if they so choose to do so. And they also can receive what is referred to as bottom surgery, which is referred to as gender confirmation surgery. So a surgery to confirm that they are the gender that they identify as. However, not all trans folks elect to do bottom surgery. And that does not make them any less trans, because as we talked about at the beginning, your gender identity is related to your heart, soul, and mind, and has nothing to do with what is between your legs or how you appear on the outside. So I just want to make that clear.
And so you were saying some people don't have dysphoria or disembodiment. They're
Exactly.
very comfortable in their skin exactly as they are.
Yes, and I brought up my friend Trish because she is one of those people that does not have any dysphoria. Does that make her any less trans? No, it does not. She still identifies as female. So now the flip side of that is that there are trans people that do experience severe, debilitating dysphoria. And I can think of other friends who have had that experience. And that is the dysphoria that happens in that situation is when a trans person looks in the mirror, the parts that they see externally do not match their internal experience. And so it can, from my understanding and the way that it's been explained to me as a person that works with trans people and a person that has many trans friends, is it's almost this out of body experience. And as I was telling you yesterday, there's this malalignment between what they see themselves as physically on the external surface, so to speak, and what they feel to be true in their mind, soul, and heart. So that disconnection and that disembodiment is severely traumatizing. And severely, it just always puts them in a perpetual state of disembodiment.
And so my question as a yoga therapist then is, do I treat it, I don't know if treating is the word, but do I engage in a way that I would just like any other type of helping someone to become embodied? Because to me, this is a totally different thing than someone who's had childhood trauma that is up in the right-hand corner of the room in Vata land and hasn't reconnected with their body, that to me seems very different than what you're talking about. So what would you say to yoga therapists in order to help trans people cope with or accept this misalignment of what they're seeing in the mirror?
Yeah. So the thing that I want to differentiate before I get to that is for people that and just to put this in the context of your original question, is for people that have experienced sexual trauma. For people, those people, are going about their life, going about their childhood, um, you know, and this trauma occurs, this sexual trauma occurs. So it's this external situation that is forced upon them, that should never be forced upon them. But so it's this, and we know through polyvagal theory that when somebody is going through that severe of abuse, that they go into the part of the vagus response, the dorsal vagal response, which is shutdown mode. Their nervous system shuts down. In the case that they can't flee from the situation, their body goes into shutdown mode to kind of dissociate themselves away from that experience.
As a survival technique.
Correct.
Or mechanism.
Correct. So the trans experience is a little bit different than that, in that trans people internally, it's an internal dissociation, because there's a malalignment between, for those that are experiencing dysphoria, it's a malalignment between what they see physically in the mirror externally and what they deeply feel in their heart, mind, and soul internally. The case that they are dysphoric and do want to undergo medical transition saves lives. Because when trans people who are so dysphoric, and some trans people, a lot of which that are not able to receive access to healthcare and receive the hormones that match their gender identity, the rates of suicide are astronomical. So it really behooves all of us to be educated on these topics and to know that when those that are dysphoric get placed on the proper hormones, the dark clouds lift and they are able to live as their authentic selves. I just had, this is really fascinating for anybody who's interested. I had a trans intersex male on Queer Story Time, and we actually did 2 episodes because
So you have to define that for people, because I think in their minds they're like, trans, intersex. Wait a minute. Can you just take a moment and break that down for us?
Yes. So intersex is, I know that this episode is going to be so overwhelming for people, so I apologize.
You can listen more than once.
Yes, please listen more than once. Intersex is intersex essentially means that, and intersex can happen. It mostly happens because of genetic anomalies. So, for example, you have your XY chromosome, you have your XX chromosome. This person that I had that was assigned female, well, I shouldn't say they were assigned female at birth. They lived their life as female for the first 32 years of their life, 31, 32. But what intersex means is this, this person had XX and a half of a Y chromosome. So this gave them, so this was nothing that they, chose to be. They were born with this genetic anomaly, and it gave them both genitalia. And the
And
way I will frame this for people, because this is the way that they articulated it, and it's kind of a goofy way to articulate it, but it gets the point across. It is that it was a hot dog inside of a taco. That was how their genitalia developed because of this um, kind of genetic anomaly that developed in utero.
yeah.
So, and that there are variations of being intersex. For example, um, so I'm just giving examples so people can make sense of this.
Yeah.
Um,
And it's not as uncommon as you would think.
no, I believe the statistic is like 1 in 100 people are intersex.
Yes.
Like it's a lot more common.
It's way more common than anyone's willing to admit.
Right, which is exactly why it's important to have these conversations. So the other interesting thing about the person that I had on Queer Storytime, his name is Darby, is so he has this external genitalia, um, but he has one functioning ovary and
Mm,
one what they call ovitesti, half ovary, half testicle.
wow.
Um, So actually, Darby was able to conceive and have a baby with his one functioning ovary.
And
So
and had a womb also.
had a womb. Yep, yep. So and there can be essentially what I don't need to go into explicit details. There can be variations in what I just said. Not every intersex person presents as my guest on Queer Storytime presents. So
And,
uh,
and and I will just also say many intersex people don't know that they are intersex. They've never been genetically tested and
yeah,
they're
and
presenting a particular way and they just kind of go with that.
that's correct. So you may have a person that presents externally as a person who's assigned male at birth, but internally they may have ovaries. Like
Right.
that's absolutely a possibility. So Darby, who was my guest on Queer Storytime, was forced to grow up. Actually, what happened was this was standard medical procedure. Now the standard medical procedure is different. Standard medical procedure for the millennial generation when we were born was that if somebody was born with both parts, you cut off the hot dog,
Mm.
um, and and so Darby lived his life as female, and then was diagnosed with generalized anxiety disorder, major depressive disorder, um, was in had a whole host of health issues, um, was just terribly depressed and mentally not in a good place until Darby recognized I'm not female, regardless of what's between my legs. I identify as male. And so Darby's maleness in a, I can't, I shouldn't say this. I shouldn't speak for him, but I almost wonder that if Darby didn't have that procedure, if they would have had a better quality of life, knowing that their genitalia matched how they identify. And so now, um, I don't know if this I don't know if this is widely accepted in the medical community. I like to think that it is, but there are instances in some of these conservative states where this probably isn't the case, um, where they still are probably removing genitalia of intersex people without allowing them to grow up and see how they identify. Then the standard, I would say, in progressive spaces is to allow intersex people to grow up and to not do any surgeries and see how they identify, which is a lot better of an approach than making a decision for somebody at such a young age when they don't even know who they are.
I
So I
mean,
hope I hope that's clear.
Talk about trauma.
Yes, yes.
And to me, when you're speaking about this, I'm just looking at all the variations of eye color, all the variations of height, all the variations of bone structure, all the why wouldn't sexuality and gender identity also be non-binary? I mean, it makes no sense to even think of it as binary, actually.
Yes, yeah, and that is what the whole idea of non-binary is getting at. Is that you know, and this comes back to kind of what I was saying earlier. Like, yes, there can be space in between the binary, so to speak, but there's also space outside of the binary, which is exactly what non-binary is getting at. Just allowing people to embody and live and dress and identify um, in a way that feels most expressive of their authentic truth, regardless of how that appears on the outside. Um, so it's why we have to be um, mindful of just asking people, hey, what are your pronouns? Um, and the other thing is for me, and I'll use myself as an example, and then I know we're getting past the top of the hour. My apologies.
I'm loving the conversation. If people think it's too long, they can stop, but I'm enjoying it. So you keep going until you feel done.
Yeah. For me, so if you're my yoga therapist and you say, okay, what are your pronouns? So for me, at this place in my life, I'm open to any pronouns.
Mm,
So if you now the thing with people that use multiple pronouns, people will use she, they, he, they. People will use he, she, they. Um, is you want to, when somebody states that their pronouns are, for example, I'm thinking of a friend's daughter who I had her mother on Queer Storytime, huge advocate for this community. Her child uses she, they pronouns. So when somebody has multiple pronouns, you want to honor those multiple pronouns and use both of those pronouns. So simultaneously use she and they pronouns, or he, she, they, or whatever pronouns somebody asks you to use all of them, not just the pronoun that matches how you perceive them on the outside.
that is
Um,
such important advice because you kind of want to. It's a little bit to get your mouth around he, she, they every single time. It's a lot. I
yeah,
mean, I'm trying to write a book, and I'm like, how do you write a book and honor all the different pronouns? You know, when it makes every sentence kind of awkward. At least the perception now is because we're not used to that.
yeah. Well, so a general rule is if you don't know a person's pronouns, the least offensive thing that you can use is call them they, a singular person they.
Mm.
Um, so that's my little bit of advice that I would offer people. If you don't know somebody's pronouns, regardless, again, how you perceive them to be from their external appearance, use they pronouns.
And give
Uh,
us an example in a sentence. Because again, this is new for people,
yeah,
right?
yeah. So I'm trying to think of a specific situation. Okay, so here's an example because I know people have trouble wrapping their mind around using they pronouns
Right.
for a singular person. Um, Say you go out to eat at a restaurant and it's raining and pouring, and you take your umbrella to this restaurant, and yeah, and one of your friends works at this restaurant, and the manager realizes that you left your umbrella at this restaurant. The manager says to your friend, who doesn't know what type of human being you are, um, your friend left their umbrella. So that's and then tells you, call your friend and tell them that they left it and to come pick it up. Um, so that's an example of when we don't know the person's gender, we automatically use the singular they without thought.
We do. You're right.
But when we see how somebody appears on the outside, we then struggle to use the singular they, because this external way in which we're presenting gives us messaging, well, maybe incorrectly perceived messaging of how a person identifies. And yeah, so it's such a, now that I'm bringing people's awareness to it, it's
I
such
was going to say thank you, because to me, somehow that just made it easier. Like, oh, Amy, you already do this. You don't have to learn something new.
yes,
Just do what you already know
yes,
more
yeah.
often.
Yeah, the thing is that we're not aware that we use singular they all the time.
Right.
It's just that for whatever reason, now that, when a person says that their pronouns are they, the argument among some people is, well, isn't they plural? No, it's not.
Right.
And we
That's
can
so helpful, though, to remind us that it's not and it never was. And we don't have to think too much about it.
exactly, yeah. So if somebody asks, so if somebody uses she, they pronouns, honor both pronouns regardless of how you perceive them to be externally. And for me, the reason why I'm okay with any pronouns, quite frankly, is because um, it's a, when you're using somebody's correct pronouns, you are honoring the essence of who they are internally, and that saves lives.
And when we don't, it traumatizes people.
Yeah, yeah.
You only have a couple of minutes. Do you want to just say a tiny bit about that? Because some people might just think, oh, I just used the wrong pronoun, but it's
Hmm.
traumatizing.
Yeah, it's this is people get sent to convert, quote unquote, conversion therapy, to try to change their sexual orientation or gender identity. These are things that cannot be changed. They are fundamental aspects of who we are as human beings, deep inside of our soul, our essence, our whatever you want to call it, the divine within. Um, and when you try to make a gay person straight, or to make a trans person cis, or use trans people actually call it dead naming. When you so say Fred is assigned male at birth and recognizes as they get older that their true identity is female, and that they want to transition to become female. They already are female, but they want to present as female. Um, and Fred has unaccepting family members that cannot accept that Fred is female. I'm making this abstract scenario. Fred identifies as Karen. I'm just gonna go with that name. Um,
Good choice.
yeah, I know. Everybody hates Karen nowadays. It's just what came to my mind. So by calling Karen Fred, by using their literal dead name, that is causing such tremendous harm and suffering by not acknowledging a human being as they tell you they are. There's this real thing with all of these anti-trans bills, all the these bathroom bills, these anti-trans sports bills, where the essence of that is that these lawmakers are telling people who they are versus people telling you who they are. And when you dead name somebody, when you use the incorrect pronouns, that is doing grievous harm and only re-traumatizing a person. And that is not what we want to be doing as yoga therapists.
And because we could do so much good by acknowledging the essence of who they are in their heart and their mind and their soul, acknowledging, I see you, I hear you, I value you, I understand who you are to some degree. Like, it's not just not harming, but it swings it all the way over to the other side of I see your Purusha. I see who
Mhm.
you are in your essence. It's really a beautiful way to acknowledge someone.
Yes, and when and the entire essence of yoga is liberation. We can't liberate one another if we don't first acknowledge the essence of who they are.
Yeah. Well, that, my friend, is such a great place to stop. And I think it's a great exercise of meditation and contemplation that we can all take away. But I would also like to have you tell us where we can find you on, if it's mostly Instagram, or is there anything on Facebook or a website?
Yes, so you can find me at my I was going to say hashtag, but my username on all social media, Facebook, TikTok, Instagram, Twitter, is at future NMD yogi. And the NMD stands for naturopathic medical doctor. So, which we didn't get to talk about too much.
I know. Tell us very briefly, how many more years of school do you have before you become a naturopathic medical doctor?
Yeah, so I actually transferred medical schools because here the scope of practice for naturopathic physicians in Arizona is very broad. So I have, because I transferred, I kind of added an additional year to my training,
Mm.
but I still have 4 years left. I'll be starting my second year this fall. So
Well, and do you plan to work mainly with trans people or LGBT people in your practice one day?
yeah, the more that I do this work, the stronger it becomes inside of me that I need to offer this to the world because there are not a lot of practitioners that are trained and well versed in trans medicine or LGBT medicine. So yeah, the more that I do this, the more that I recognize that that's going to be my population.
I love it. I love it. And I think for us yoga therapists, it will be wonderful to have you to refer our clients to
Yeah.
as a safe person that we can trust and know that you understand how to work with the LGBT and trans communities.
Yeah, and that's something I just wanted to end with too is, if anybody does have any questions for me about anything that I addressed in this podcast, or I know that this topic can be so overwhelming. Um, and, think of this in the same way as our yoga practice. We don't just learn yoga. We don't just learn the principles, ahimsa, satya, truth, the yogic philosophical principles. We don't just learn that in one day. So if you're feeling overwhelmed and maybe a little bit stressed by all of the information that I'm throwing at you, I'm available. Please reach out to me.
Yeah, and
Um,
watch Queer Storytime. I'm learning so much from you and your guests.
yeah.
Like, I am learning. It's like a college course in, okay, Amy, get it together. You learn this, understand this. And I have to keep repeating it. I read an article recently that said the proper way to learn is to learn and forget and learn and forget and learn.
Right.
And
Yes.
that's what we have to do, is learn and forget.
Yep. There's a the science of spaced repetition, which is basically
Yeah.
that you, in order to truly learn something, embody it, you actually have to forget it. And it's in that struggle of you trying to actively recall the information that you forget that you actually, it becomes more embedded, neurologically speaking. So
And you right now have 43 queer storytime opportunities to have spaced learning.
yeah, yeah.
Oh, well, thank you so much, Stephen, for staying, a little bit longer than we had planned, but I feel really content and complete. And thank you so much.
Yeah, thank you. This has been an honor to speak on this topic, and I'm so grateful to be here.